We're going to follow traditional debating rules, and we have two superb teams proposing the motion that this House believes that patients should not be responsible for the safety of their healthcare. Peter Walsh. Peter is the Chief Executive of Actions Against Medical Accidents. He's been a campaigner for patient safety for over 10 years. He was a core participant in the Mid Staffordshire inquiry and has led AVMA's campaign for the statutory duty of candour. Seconding him will be Brendan Delaney. Brendan has already been introduced. He's our new Director of the Centre for Patient Safety and Service Quality. He's Professor of Medical Informatics and Decision Making and is a practising GP. Opposing the motion, we have Tony Avery. Tony is also a GP and is a researcher, a long-time researcher in patient safety. He's Professor of Primary Care and Dean of the School of Medicine at the University of Nottingham. And seconding Tony to oppose the motion is Fran Hassan. Fran has had a career in broadcast journalism, but after a late diagnosis of leukemia, she's become a champion for patient safety. She works with a variety of projects within the Clark here, and also sits on a number of national scientific committees helping advise on patient safety, particularly on medication safety and infection prevention and control. So as I say, we're going to follow debating rules, so with each speaker having a timed slot, and we'll try and keep people to time. The proposers of each motion will have 5 minutes and the seconders 4 minutes. We're then going to have some rapid fire points from the floor, and this I'd like you to think about as the speakers are talking. We want points for and against, and some quick points, nothing too long because we haven't got much time. Then we'll have a summary from each side, summary and hopefully some more arguments, before we have a vote. So as I say, we want a lively debate and we want some controversy, so they're not exactly combatants, we don't want them to come to blows, but maybe let me start by introducing Peter, who's going to propose the motion.
Thank you, Susan. Well, somebody had fun when they devised the title of this motion and this debate. Those of us taking part in the debate didn't actually choose the title. I suspect it, and we've already heard, it's deliberately provocative to stimulate a discussion and a debate. I expect, and I certainly hope, that when you've heard both sets of debaters, you'll actually see that probably, I hope, neither of us actually believe in the literal meaning of the motion and its opposite. But as it stands, I do strongly propose the motion that patients should not be responsible for the safety of their own care. To help you understand the context of why I feel so strongly about that, Susan alluded to my role. I work in a charity that's all about patient safety. It's about supporting patients who have experienced things going wrong in patient safety. And I challenge anyone in the room to come and spend a day in our helpline listening to some of the thousands of calls we get each year, all from people whose lives have been devastated by things going wrong in healthcare that were the responsibility of the healthcare system or of those working in it. Now, having said that, we can't take things too literally. It isn't that black and white. So I'm just as passionate about patients being actively involved, being partners in their own care, and playing a role in the safety of their own care. And I believe that's a very, very underdeveloped role for patients that should be built on and expanded. However, that's not the same as saying that they are responsible for the safety of their care. I'll give you a practical example. As we know, one of the biggest areas of things going wrong is in medication. Now, if I'm prescribed a powerful drug and the risks and the benefits and the alternatives are explained to me properly, there's proper consent, and I agree to go along with the dosage that's been prescribed for me, but I'm told don't alter that dosage, don't drink with it, and I decide to treble the dose and go out on a binge, and I suffer the consequences, I think I take some responsibility for that aspect of my safety. But what I can't take responsibility for is the wrong decision being made by a professional who is skilled, competent and knowledgeable in the benefits and the risks of a known treatment and what should and shouldn't be done. So if the professional advice was to give a certain dosage and it was wrong, or has dispensed the wrong dosage, that's outside of my control. And of course the fact is that the control of safety in our own care largely, not totally, but largely is beyond our control. What about if it's simply too complex? We can't understand it. What if we're not conscious because the procedure, the treatment is taking place when we are unconscious, as much surgery, for example, happens? What if we don't have mental capacity to actually make decisions? So yes, involvement, particularly at the stage of decisions, and patients being properly empowered by information to help them make informed decisions and give truly informed consent. And patients can be the best monitors of their care. They can be the experts in their own care, particularly with long-term conditions. But no, don't change a well-understood system whereby it's people with the training, the knowledge, the skills who take responsibility first and foremost. Why should things be different in healthcare? The proposal is about healthcare. If we were getting on an airplane, the pilot takes responsibility and the aircrew for our safety. Okay? Of course, if we get up and do something stupid and compromise the safety of the aircraft, we're taking it out of their hands. But we wouldn't, in any other walk of life, countenance the idea that you actually make the people who are the recipients, the victims of things going wrong, the people who are responsible for it.
Thank you very much, Peter. Tony.
Great, thank you. Can you hear me at the back? So, as Peter says, then we probably aren't that far about, but I would like to strongly oppose the motion. Wouldn't it be wonderful if we lived in a world where patients did not have to take any responsibility for their healthcare? This will be in a world where we could completely rely upon healthcare professionals to get things right 100% of the time, for equipment and IT systems never to fail, for communication to be perfect. This is not, sadly, the world that we live in. We live in a world where patients are regularly, unfortunately, harmed by healthcare in every type of healthcare system in every part of the world. For decades, there have been concerted attempts to try and get things right, but still patients are being unnecessarily harmed. And while the tide is turning, I can tell you that however much we invest in healthcare and safety systems, we will never reach a point at which avoidable harm is eliminated. Now, should we throw our hands up in horror about this, or should we try and use every single approach we can to tackle the problem? This is where the patient comes in. Informed patients are essential to the safety systems we have in healthcare, and if we deny patients responsibility for their safety, we inevitably increase the risks that they will be harmed. However compelling the motion to this debate may seem, if you vote in favour, this will make things worse for patients, not better. Fran and I agree that the primary responsibility for patient safety lies with the healthcare system, and that patients cannot take any responsibility, as Peter suggests, if they are too ill. But in most situations, patients are able to contribute to their care, and they have a responsibility, if only to themselves, to help protect against errors or mistakes. Now, this is not such a radical idea. In virtually every other walk of life, people have to take some responsibility for their safety, whether you are working in a building site or crossing a road. Why should it be any different for patients in healthcare? There's no reason at all, unless we're stuck with the outdated notion of patients being passive recipients of healthcare, rather than active citizens working in collaboration with healthcare professionals to achieve the best outcomes. Now, in a few moments, Fran's going to give some examples from her experience that demonstrate the importance of patients taking responsibility for their safety in healthcare. This is more powerful than anything that I can say, but I'll give you an example from my experience. As you know, I'm a GP, And one of the things I'm most passionate about is how we can find ways of improving safety and avoiding patients being unnecessarily harmed from errors and mistakes. One of the things that's driven me is the principle of first do no harm. And yet, despite my best efforts, I sometimes make mistakes. So to just give you an example, a few years ago, for a very busy afternoon, I rushed into surgery to do my surgery. I was stopped by the receptionist, asked me to do a prescription, come through from the hospital. Patient had been discharged that day. Please prescribe a drug called trimethoprim, which is an antibiotic. So I rushed off a prescription. I got on with my surgery, then got interrupted halfway through the surgery by the patient who politely pointed out that she was actually allergic to this drug. So I apologised and gave her an alternative. The point here is that this patient took responsibility there for her safety. She didn't go down the doctor knows best route, which would have led to her actually coming to harm. One of the best ways in which we can improve safety in healthcare is to have better safety systems. This is not about blaming individuals, but working out the best ways of doing things where different people take different responsibilities at different stages of the patient journey. And we commonly, I mean, you'll be familiar with this, most people here, use what's called the Swiss cheese model. For those of you who are not familiar with it, imagine slices of Swiss cheese as your safety barriers, and they've all got holes in them. So in the example I just gave you, the hospital should have known that the patient that I was referring to had an allergy to penicillin. But that got through their sort of safety barriers and came through to me. And similarly, I should normally have systems in place to stop that sort of thing happening. But that got through my safety barrier. And it got through the pharmacist as well, who also ought to have known this information. And so the patient here was the last line of defence. And because she took responsibility, she is able to protect herself from harm. So if you recognise that in the real world, patients will inevitably be harmed if they do not take some responsibility for their safety, then I urge you to vote against the motion. Voting against the motion will help to ensure patients have a continuing and literally vital role in safety in healthcare. Thank you.
Okay, good. Right. Hard act to follow, but let's focus a little bit on what the motion actually says. That this House believes that patients should not be responsible for the safety of their healthcare. It's not, should not be involved, engaged, and otherwise led to be part of their healthcare, but responsibility. I'm a great believer in preciseness and semantics of things. So I actually looked up what responsible says in the Oxford English Dictionary. And it says answerable or accountable for something within one's power, control or management. Now, I do not believe that patients should be answerable or accountable for patient safety. They are the recipient, or should be the recipient, and the participant in a safe healthcare system. Those who should be accountable for that system are the professionals, the managers, the politicians, and the people who work in that system to provide the benefit for the patient. So we think of the aircraft situation that we had this morning with the fire on that. If we had a situation where patients were responsible for that, whose fault was it that the engine burst in flames? No one's. From the passenger's point of view. Clearly, they had a role in the safe of leaving that aircraft, but it's British Airways, their technicians, Boeing, who have the responsibility for ensuring that the aircraft is safe, where clearly there'll be some problem. Now, in healthcare, we have a major problem. My particular interest, along with Olga, is in diagnosis. It's because I'm a GP. The main thing that we do is we diagnose patients. It's our skill, if you like, that we train for. But we're not very good at it. Doctors aren't. Studies have shown that between 5 and 10% of diagnoses are wrong. Most of the time we don't even know they're wrong. It's blissful ignorance. Olga and I have done studies of slightly more complex cases for people to solve, where the baseline unaided rate is 50%. It's tossing a coin. So we're interested in improving that diagnosis. Now, clearly patients have a role as the person with the problem, to tell the story, to be clear, to help the doctor to understand what's going on. But it's the doctor and the systems that they're using who are making the safe diagnosis on there. Now, how can we improve that system? We've had various suggestions over the years with lots of work on incident reporting, scratching the very surface of what's going on. There was work looking at outliers. It's a complex socio-technical system, but actually I propose to you it's beyond that. It's a complex cyber socio-technical system where we have data and computer systems that can be much more responsible for the safety of that health system, and I call that the learning health system. And I think learning health systems are the way to go with that. And it's the responsibility of all of us to make that learning health system a safe learning health system that involves patients as part of that system, but the responsibility is ours as professionals to do that. Patients are part of it, but they are not responsible for it, and I commend the motion to this House.
Thanks, Susan. First of all, Susan should probably have mentioned that I'm disabled. I've got respiratory conditions, so I'll ask you to be patient with my sometimes difficult speech delivery. I would like to start by referring to what Professor Avery's comments about the role of patients as active citizens working in collaboration with healthcare professionals to achieve the best outcomes. My own experience of what safety means starts with a random blood test at St. Mary's Hospital and a surprise diagnosis of imminent death by acute myelodysplastic leukemia. Treatment lasted 10 months, which is a very long time when you're kept in total isolation from the outside world. But such a long stay in hospital also meant a lot of time to learn about safety and other concepts of healthcare. Particularly as I was very, very lucky, in fact I was privileged to be treated by a fantastic team, the hematologists and other professionals who were very, very keen to involve the patient as much as possible at all stages, interventions and procedures. Indeed, you could very well ask whether a patient was connected to zillions of tubes who's been rendered very, very weak by the aggressive chemotherapy regimen and unable to move from his bed can do much in terms of safety. Well, the reality is that, in fact, yes, he or she can. Double-checking the patient's identity tags on the chemo bag, especially when the treatment is being administered very late at night by an exhausted junior doctor, represents a protection both for the patient and for the clinician. It's a joint piece of checking and work. Partnering was the framework used by my treatment team. While clearly the team didn't expect me to be responsible for the inserting and use of my central line, a lot of information, in fact a hell of a lot of information, was given to me to make me fully aware of all the infections, of all the dangers which could arise from a negligent handling of the connectors, the bonds. This was designed to enlist my help in carrying practical observations when non-regular staff had to use a central line. Well informed about the infection control practices, it would have been much easier for me, and quite easy in fact, to remind a nurse or a phlebotomist that perhaps more care should be given to the way they were handling and cleaning the bonds. The patient may be a kind of inert mass on a bed, but as long as he's fairly alert and conscious, he can observe, suggest changes, report potential harm or risk to the team lead, and not just for his sake, but also for the sake of the whole team. Transparency was another important factor in my treatment. In addition to being given information about my numerous medications, I also witnessed the team's discussions, at times debates, on the right medication to give me, given that I had all kinds of pretty ghastly disease since I had no immune system for a heck of a long time. Nothing like such discussions to give the patient a notion of the extreme complexity of medicine, of the need to be vigilant at all times for potential side effects and adverse drug reactions. This learning was put to good use when, years later, during hospitalizations for lung disease, nursing staff mistakenly tried to give me the wrong medicine. I was fully prepared for it and knew what to do. In conclusion, I would say, in fact, I would plead that patients' sense of their own safety, of self-management of their medications, of self-care, of involvement in procedures, monitoring surgical site, for instance, and of being should not be taken away simply because they happen to be confined on a hospital ward or visiting their GP practice. Safety is basically everyone's responsibility. Thank you.
Well, you've heard both sides of the arguments. Can I ask for some points from the floor? Can you say whether you're for or against the motion? Do we need a microphone? Yes, Adrian.
Thanks, Susan. So I was undecided, but now I'm definitely against the motion. And it's a really interesting question, and I don't think it's an artificial one, and I think it's the points that Fran was alluding to. So if we accepted that motion, we'd be saying that patients have no responsibility for their healthcare, and we make them passive recipients. And we understand more and more, based on the research of organizations like CPSSQ, the huge importance of the patient involvement and engagement in making the healthcare system as safe overall, as well as for their own individual care, as it can be. And it is a responsibility that's shared. There is a responsibility that we give to and empower patients to have, and that seems to me to be a fundamental point.
Great, so we've got one person who's changed their views, yes. And then the lady in front.
Sorry, I'd like to just continue with that as to whether anybody saw how many people off that aeroplane had taken their hand luggage off with them. And that plane was clearly on fire. And I absolutely agree
Yes.
with that. The analogy of that, you said that they are not responsible for the safety of that plane. And those patients had sat, those passengers on that plane had seen the safety video that says at all costs you get off that plane. And I was staggered as how many of them were standing there with their hand luggage. So there has to be something about educating and involving people so they understand the consequence of their actions as well as their inactions.
The safety videos on aeroplanes don't work. Yes.
I completely agree that patients should have some responsibility with their healthcare. But one of the things that the GP mentioned was that he was told something by the patient, and he reacted on that, and he listened, and he resolved the crisis with the medication. But not every person listens to when the patient talks. And this one is step one is a frustration. And if you're not giving them the responsibility, the accountability, if you're not listening to them, then they can't feed you back important information, which could lead to wrong diagnosis, and then hence wrong medication. So listening diagnosis, I think, is the bridge which might help.
Does anybody support the motion that the patients should not be responsible for the safety of their care? If there's one comment in favour of the motion? Yes? And then that's our final point before we have our summary and our vote.
Sorry to take the final point. I want to go back to what we talked about earlier in the development of the welfare state, and I think that there's an inequalities thing we have to think about with this motion. And the NHS is a very particular part of the welfare state in that it has patients in it who are not just socially excluded. We also have very well-off patients, well-educated, patients who have had the opportunity and the encouragement to be engaged since day one. It also has patients who have, for whatever cultural or whatever background reason, never had the encouragement to question a doctor, or have the resources to actually enable them to question or to make a decision about their care or to even know if they have an allergy to a medication. So while it would be ideal if patients had some responsibility, I think that relying on their own responsibility for having them be ultimately responsible seems like it could also further these inequalities.
Great, thank you very much. I'm now going to hand back to Tony for the summing up for the opposition.
Okay. Right, can you hear me again at the back? So I think that Fran and I have really made the case for the importance of patients taking some responsibility for their healthcare. I mean, I think it's interesting the comments from the floor on that. But you know, as part of the safety system, it's just clearly important that, as I said, that the patient in many ways is that ultimate barrier, that ultimate ability to take responsibility and stop a serious thing from happening. But one of the things that I really do need to take, I think the only remaining thing that might be a doubt in your mind is around the semantics here and around what do we mean by responsibility. And well, Brendan has been smiling because he knows what I'm going to say. Because he has looked up the dictionary a dictionary definition of responsibility, and likewise I have. And in fact, in virtually every place you look, there are two definitions. And one is about being accountable and to blame for something, and Peter raised this as well. And of course, we're not talking about that. We're talking about the other definition of responsibility is having a duty to deal with something. And we do believe that patients have a duty to themselves, at a minimum, duty to themselves, a responsibility to themselves to be involved where they can, of course, you know, accepting that if people are too ill, then of course they can't. But in patients who can make a contribution, they do, we feel, have a duty and a responsibility. And that indeed, as I said during my talk, inevitably, if patients are denied that responsibility, there will be harm. If patients are allowed that responsibility and indeed encouraged to have that responsibility, then that will be better and safer for healthcare. So thank you.
Thank you. Andy?
Okay, I'm just going to say that I think people are debating a different motion here, because the motion we're debating is quite clearly about responsibility being loaded on the patient instead of the system and the health professional. There's absolutely nothing in what my esteemed colleagues in the opposition have said that we wouldn't agree with as being desirable. There has to be empowerment and involvement of patients. However, the motion doesn't say that we're against some responsibility, a role, some involvement. Those are all things, of course, we're going to agree upon. The danger in opposing this motion is sending the signal that the responsibility that quite rightly mostly rests with the system and the deliverers of healthcare to ensure safety is watered down. It would be a shift of responsibility onto the shoulders of people who shouldn't be carrying that responsibility. And just imagine yourself on our helpline or facing a room full of people from mid-Staffordshire, as I have done, and telling them, actually, you were responsible.
Thank you. Okay, so now it's time for the vote. So can I ask all those in favour of the motion that this House believes that patients should not be responsible for the safety of their healthcare, to back up Brendan and Peter, put your hands up.
What about Fran?
And all those who are agree with the opposers of the motion, with Tony and with Fran, hands up. Oh dear.
Oh, clear win for the motion.
I'm not going to count it, but I think we've actually got about a 50-50 split.
Yeah.
Can I just ask those of you who actually changed your view as part of the debate, can you put your hands up? Anyone changed your opinion? Well, we swung 1, 2, 3, 4, 5 or 6 people in the debate. So, well, I hope that's posed you some thoughts and thinking about whether patients should be involved, how they should be involved, and the responsibility of the system. So, can I ask you to thank all our debaters?
Thank you.